It's wonderful and exciting to be here today to talk to you about this new Emerging Minds funded project, which ultimately aims to help bridge the gap between evidence and practice and advance our understanding of the implementation and, I guess, sustainability of evidence-based practice in children and young people's mental health. So for those of you that I haven't met yet, I'm a postdoc in Professor Alan Stein's Child and Adolescent Psychiatry team in the Department of Psychiatry at the University of Oxford. And my research focuses on the evaluation and implementation of evidence-based practice, with a particular focus at the moment on digital interventions, although this project doesn't have a digital focus per se. And I guess before I go any further, I'd just like to acknowledge that this is a collaborative project and it's a team effort with some wonderful colleagues, some of whom were my co-applicants on this bid. So Tim, Sarah, and then Tanya and Georgia from the Pain Foundation. So when I use the term we, then it's this lovely bunch that I'm referring to. Okay, so I guess the problem we face then is, despite the fact that there's been a kind of increase in access to services and a proliferation in the number of interventions available over several decades, outcomes for children and young people could still be improved. And I think this can be attributed in part to this kind of complex and lengthy process of implementing research into practice. So providers of services, so kind of clinicians and practitioners, are faced with a complex array of barriers which can impede the implementation and adoption of kind of established evidence-based practice. And then at the same time, researchers can face real challenges in progressing their findings into real-world settings. So I know firsthand from working on an intervention trial that it's quite complex, really, and not always a straightforward process. And we know that there are common barriers such as time, funding, and resource constraints, which all play a significant role. But one thing I noticed when I started to do research in this area is that often implementation outcomes in research are not recorded or reported, and implementation efforts often lack a kind of solid theoretical or model-based approach, making it quite difficult to understand and explain why implementation succeeds or fails in different kind of local contexts. So I think assessing implementation outcomes and implementation determinants using an integrated framework may help us to kind of move things forward and improve understanding beyond what we already know. Okay, so how are we addressing this problem then? Well, our research team was already kind of interested in this area, and we'd kind of previously used models, including one called the Paris framework, which I'll come on to in a second, to make some important advances in addressing this challenge through, I guess, several kind of complementary strands of research. And this includes things like systematic reviews, looking at the barriers to implementation, and important work done by Tim and the Bridge Special Interest Research Group, which has informed the research questions and the design of this project and has shaped the priorities and outputs. So it's been fundamental, really. But I think despite all that work that we've done already, highlighting several barriers, what we're lacking is a kind of a coherent, theory-driven account of implementation barriers, along with a kind of reliable and valid tool to measure these in a systematic and comprehensive way. Okay, so I think the main thing says that we hope this is going to be an impact-driven project, and that our aim is to move beyond the learning and scoping that we've already done. And the next step really involves kind of moving our learning forward to leverage real change and impact. Now, to do this, we'll use an implementation framework to investigate the barriers and facilitators of implementing research into practice, and go on to make recommendations across clinical, commissioning and academic settings, and really hope to kind of encourage greater coherence between researchers, commissioners and practitioners. And we'll do this in collaboration with the Pain Foundation and young co-researchers. So we'll use a kind of theoretically informed survey and then qualitative interviews to gather case study data on the implementation of evidence-based practice. Okay. So I think importantly, what we're doing is we're using an implementation framework called the Paris framework to take a systematic approach to measure those barriers and facilitators, I guess. So I think without which the approach to addressing implementation challenges would continue to kind of be fragmented and lack that kind of systematization and potentially move quite slowly. So I guess just briefly, Paris examines the interaction between three key elements for knowledge translation. So the model essentially proposes that you need three factors to determine research use. So that's evidence, context, and facilitation. and that successful implementation is reliant upon the context of the setting where the new evidence is being introduced, and then how that new evidence is introduced, so how it was facilitated into practice. And they're just as important as the quality of evidence itself. So things like, do researchers involved in the development and evaluation of evidence-based practice have the necessary support in terms of budget or financial kind of resources and staffing? Are leaders and management on board? Is there a kind of implementation plan? All those things are important. So we have 4 key research questions that we're hoping to answer across the course of the 6-month project. So in terms of the survey, it's already been developed and piloted, and items were developed through kind of triangulation between the model itself, existing validated tools that have used the Paris framework, and then our systematic reviews, the literature, and then the bridge network as well. And it's different subscales which all align with the Paris framework. So evidence assessments, people's perception of the strength of evidence. We have co-production and youth and family involvement, consideration of commissioners and clinical experts, and the context assessments, so that's leadership, culture and staff, resources, and then the facilitation process. And it's measured mostly on Likert scales, so the subscales can be calculated and then validated. And then those involved in the development or testing or implementing of evidence-based practice will be invited to complete the survey. And then next we'll carry out some qualitative work with key stakeholders, including commissioners, to get a more in-depth understanding of these issues. And then we'll move on to a question around answering kind of future implementation efforts. Okay, so I just wanted to briefly point out that the meaningful involvement and collaboration with those with a range of experience, so including young people and parents, was important for us in this project. And the project will be conducted in close collaboration with the McPinn Foundation and Tanya McKay, who's a co-applicant on this on the project, and she'll help guide the work and the youth and voluntary sector involvement. And we have 2 young co-researchers involved throughout the duration of the research too. So I think the outputs and the impact are a key priority, and what's really going to move this work forward beyond where we currently are. So I've already spent a great deal of time trying to understand the problem around implementation. Now we want to kind of create real impact and change. So we hope this work will produce several kind of tangible and useful and usable outputs for stakeholders and commissioners. That will include the survey itself to be used by services when implementing evidence-based practice, and then a toolkit for commissioners as well. And again, youth involvement in the dissemination of the outputs will hopefully ensure impact across the stakeholder groups and disciplines. And then just finally, as I mentioned, the aim is for this to be as impactful as possible, and we hope that the project will generate findings on the barriers and facilitators of implementing evidence-based practice in the UK, and hopefully that will enable us to provide or create recommendations on how to develop a successful implementation strategy and hence deliver evidence-based practice into services. And I think in terms of kind of next steps, based on the findings of this research, subsequent projects that we're hoping to kind of lead into will increase the abilities of stakeholders to kind of develop, use and implement and scale up evidence-based practice. And a key next step for us, I think, will be developing a toolkit that can be used by service commissioners to, I think, one, decide on what evidence-based practice are most appropriate to their local population, and then how to decide how to kind of adapt evidence-based practices developed in more homogeneous samples and research for more real-world contexts. And again, the co-researchers will be essentially involved in that. So I'll just end by saying thanks to my co-applicants and of course Emerging Minds for kindly funding this research.